Hello, everyone. I would like to introduce you to Dr. Caroline Lloyd. Caroline is a highly qualified health professional with 30 years of experience as a GP in Australia. Caroline has a Masters of Counselling and has now specialised in a form of treatment for trauma called EMDR, or eye movement desensitization and reprocessing. So we often hear about the relationship between mental health and lifestyle factors, but the context is often how a healthy diet and exercise can be beneficial for our mental health. What we don't often hear about is the relationship that occurs in the other direction. And that is how anxieties and previous traumas can affect our physical health and influence what we eat and our relationship with food. So sometimes addressing the underlying trauma and psychological distress is the first step in not only achieving better mental health, but better physical health as well. And so I'm so excited to have Caroline here today to help us understand that relationship between mental health and specifically trauma and its impact on our physical health. Just to get started, I'm wondering if we could just look at what constitutes trauma.
Thanks so much, Ros. It's what I love talking about more than anything else, actually. So trauma there's lots of different definitions of trauma, but one definition that I quite like is an event that exceeds a person's capacity to cope. So, there's lots of different sort of statistical definitions of, it's this kind of abuse or that kind of abuse or witnessing violence, that sort of thing. But basically, if something happens to you and it's outside of your capacity to cope, then that constitutes trauma. So, for some people, they may be able to be, for example, in the police force for 10 years and nothing that they come across exceeds their capacity to cope. But then they have a little bit of a build-up and they see this event and that event, and then next week there's another event, and tomorrow there's another event, and it might be a small event that in the end is what exceeds their capacity to cope. They can no longer even look at their uniform. They can't contemplate going to work, and everything falls apart. So, I use this analogy of like your hall cupboard, and it contains all sorts of things, old tennis rackets and Christmas wrapping paper and tennis balls, all of those little bits and pieces that we just shove in the hall cupboard. Now, you can do that to a certain extent with traumas, or difficult things that happen to you in your life, like, you can put the divorce in there, you can put losing the house in there, but then you put that one extra little thing in that hall cupboard and it won't close and everything spills down on top of you, and then you have to start cleaning up the mess. And it's a bit like that with life events. One thing can happen, another thing can happen, but when it gets to that kind of just that one extra little thing, we're no longer able to cope, and then we fall apart. So what does trauma look like in people? Like, sometimes it presents as your classic PTSD, which is hypervigilance and, replaying the event,
Right.
and difficulty sleeping and nightmares and anxiety. So that's your classic kind of PTSD presentation. For other people, they try and enhance their capacity to cope via substances. So that might be alcohol, it might be food, it might be prescription medications like Valium. Sometimes it's something like Phenergan, which helps them to sleep at night, which you can buy over the counter. So it's like, sometimes we turn to substances to help us cope. For other people, it's behaviours like gambling, online shopping, those sort of addictive behaviours that give you a little bit of pleasure or just enough to kind of get you through, which are very harmful in the long term, but in the short term, they're usually coping mechanisms to cope with trauma.
It may not just be one single event, and that we can accumulate a lot of little micro traumas along the way.
Yeah.
And then we just reach that tipping point.
Yeah.
And it's just too much. We can't cope.
Yeah.
I think in the last couple of years, a lot of people have experienced that throughout the pandemic, and, teachers, nurses, burnout. I'm imagining that even if it's not diagnosed as trauma, people are carrying the weight of experiences. How have you witnessed clients progress towards better health, towards better mental health and physical health, and address that underlying trauma through EMDR?
So, as you know, I'm an EMDR practitioner, so I love to use EMDR for trauma. It's a very particular kind of therapy, which was originally created to cope with trauma, or as a treatment for trauma. And originally, it was sort of confined to PTSD, but I use it a lot and with everybody. So even if people haven't kind of reached that threshold of not coping anymore, if we can resolve some of those traumas that have happened over the last few years or happened over their lifetime, then that gives them a strength that they didn't have, and it sort of, immunizes them against sort of further trauma if they're not carrying a traumatic load already. So quite often the things that distress us in our daily life are things that resonate with past experiences. Like, for example, if someone's bullied in the workplace, or if they have difficulties at work, which a lot of nurses and people in particular had during COVID. But I think nurses and healthcare workers were one of the groups that were particularly affected by that. They had to, change their workplace practices very suddenly and quite profoundly. And there were lots of limitations placed on what they could and couldn't do. And so, for a couple of nurses that I treated during COVID, those changes came with a lot of pressure from above. Like they had a lot of admin directive, reams of them every day. And for some people, that sort of resonated with previous traumas. So, if they had had a similar experience in the past, maybe they'd been bullied at school and, had some interpersonal difficulties at school, that gives them some ideas about themselves or some cognitions about themselves of maybe I'm not good enough, or I can't cope, or people hate me. And then even if those don't sort of play out in happy times, when you get to a traumatic time or a period of high stress, those kind of cognitions about yourself can become quite marked, and that makes you they resurface. Exactly right. That's a lovely word for it. And then they become much more susceptible to the incidents that are happening in the current time. So usually when I'm treating trauma, I will take a thorough history of what's happened to you through your whole life, the good and the bad, the times where you felt very capable and felt loved and felt protected, and also the times when that wasn't the case and things were difficult. And then relate that to what's happening to you at the moment and the difficulties that you're experiencing at the moment. And then we formulate a plan to deal with the current day issues alongside what's happened in the past. And if we can heal both of them sort of concurrently, then, that goes a long way to kind of bomb-proofing for future as well. So in EMDR, we take very much a sort of a past, present and future approach. So we deal with the traumas of the past, we deal with the traumas in the present, and then we enhance people's capacity to cope with things that may happen in the future. And that often relates to people's fears about the future. Like if they've had bad things happen in the past, quite often we are worried about the future. So if we can alleviate those fears about the future, then you're in a position to lead a much happier, more fulfilled, easier, calmer life.
I'm wondering, with your extensive experience as a GP and practicing in that space for 30 years, and now making the transition into alternative medicines.
Yeah.
Are there any issues that arise in sort of having your foot in both of those areas, in traditional medicine and
Yeah.
alternative medicine, or is it an easy way forward now?
Yeah, look, I find that I do still have a foot in both camps. I haven't left behind the general practice side of it entirely. You know, I think sometimes medication is really necessary.
Yeah.
It's often part of the picture, and I guess
Mm.
that's where I come from. It's never the whole picture. So
Right.
medications for mental health are never the only
Mm.
answer. You know,
Yeah.
they're not the full picture. We can't just give an antidepressant or just give something for anxiety or to help you
Yeah.
sleep and
Absolutely.
expect to fix the problem, because
Yeah.
it won't. Because the problem comes about because of your past and your experiences, and you know how your brain is kind of processing those things now. So I always treat medication with a bit of a gentle hand. Like I don't push medication. I don't love it. You know, all medication has some sort of side effect, and you have to take into account the sort of cost benefit analysis. And what I will often say to people is, if you're stable enough now, we can do the trauma treatment, and then we can have a look at reducing or getting you off the medications in the longer term, which I tend to do very gently, because especially with antidepressants, it's a bit brutal to stop them suddenly. So I tend to taper down, you know, quite gently. But sometimes they're really essential to just get that stability before we start the trauma treatment. So dealing with all the deep, dark corners of your past can be scary, can be agitating. And even though EMDR works a charm, it's a beautiful therapy. It's very, very effective. We do take one memory at a time, and whilst we're working through them, we want you to be able to live your life with the most stability that you can. So, yeah. So the first few phases of EMDR are about stability. So they're about taking a history, helping you rediscover your strengths, and making sure that you have the capacity to hold the distress of the trauma memories when we do kind of, you know, front those
Yeah.
memories. It can be difficult work, but it's always worthwhile, and it's really helpful. So, yeah, so I guess the medications and the trauma treatment go hand in hand, but I tend to kind of go lightly with the medications, but know that, yes, sometimes they are an essential part of the picture, sometimes they're a helpful part of the picture, and sometimes they're not part of the picture. It's always a discussion and a collaboration around them, and just you know, making the decision based on what we see as the perceived benefits and the perceived drawbacks of them, of the medications, and taking it from there.
Great. It's always, any treatment is always such an individual approach.
Mm.
And as I'm learning more about alternative techniques and treatments, I really believe that there's a place for both the traditional medicine and the alternative, and it's a
Yeah.
working together with the individual. Each individual is unique, and it's just a
Yes.
matter of assessing the
Yeah.
needs in each situation and what will work best for that person.
Yes,
Um,
absolutely. And there is more to trauma treatment than just EMDR, and it's a beautiful adjunct to things like somatic work. So things like yoga and
right.
trauma-informed boxing, for example. So yeah, so getting into
Interesting.
your body and feeling your body is something that people, especially people who have experienced some pretty awful childhood trauma, have a real, or can sometimes have a disconnect from the body, because the body was too scary a place to be.
Right.
So,
Right.
so if we can just gently sort of encourage that capacity to be in your body, and that may just be, so trauma informed yoga it's a beautiful therapy, and for some people that is kind of the starting place. Some people can't manage that at the beginning, and it might sort of sit a bit later down the trauma treatment plan. But certainly, there's a great book called The Body Holds the Score by Bessel van der Kolk, which is I think it's nearly got a cult following now. It's and it's all about how your body holds trauma. And certainly with EMDR, with a lot of other therapies like cognitive behavioral therapy, they're all about the thinking. So they're all about the thoughts and teasing out, what thoughts am I having and how that affects me, my emotions and so on. But so this book was really revolutionary in kind of bringing to people's attention that the body has a very important place in therapy, and is actually called a somatic therapy, in that it takes notice of the body because memories are held. So we hold a picture of a memory. We also hold the smells to do with the memory. We also hold the sensations or the feelings that the body has, the distress and the emotions, and also the beliefs about ourselves. So each memory is it has lots of different aspects. So it's not just a visual memory. So it's not just, say, the picture of the teacher's face when they were telling you off, or the bully's face as they were teasing you from your childhood. It's the smell of the schoolyard, or the smell of the chalk dust, or particular cologne is often like quite a triggering factor for people. So those things and the sense in your body of that memory is also really important. So, quite often while we're processing a memory, someone will go, "Oh, I just got a really bad headache," and I'll go, "Okay, if you can just gently notice that for the next set, while we do the next set of eye movements, then see if you can just allow that to be there." And then we do that, and this happened the other day. This is why I'm mentioning this. Like, someone came up with the headache, and then we did another couple of sets, and they said, "Actually, I remember now, I got hit on the head by this." It was part of the memory that they were actually hit on the head. Yeah. They didn't remember
reoccurred in a space where they're completely safe, but that memory of it is there in the body.
Exactly right. And that happens very frequently. Like I see quite a lot of people who have medical trauma. I think it's because I'm a GP. People tell me about things that happen to them, in surgery or after surgery or whatever. Yeah. And it's happened a couple of times that we've been processing a memory of after an operation, and people will get very shaky. They'll get the rigors, they'll get the whole body shakes. And I say, this is okay. It's just your body remembering where you were at that moment. It will pass. And then we do a couple more sets and it passes. But it's just held in that same memory network alongside the pictures.
Does your treatment bring in, if you're desensitizing them to those triggers, do you bring in those smells or whatever it is?
Great question, Roz. That's such an intuitive question. Yes, so we do. So we can approach therapy lots of different ways, but sometimes we always work from what's most important to the client. Mm-hmm. So if they come into me and they say, "Look, there's a new person at work and they wear this perfume and I can't stand to be near them. I can't go to a meeting with them." Say, okay, that's what we need to work on. So we'll do that probably in a couple of sessions. But one thing we can do is actually bring in like a little sample of that particular scent, or sometimes that they can just imagine it, and then we desensitize that trigger. So we actually work on that trigger. That's our target for the day, and desensitize the trigger. So we've got a few different techniques of working with that, but it's a great question and a really effective way to work.
Yeah, it's so important because often the triggers are outside of our control.
Yeah,
so if we can address what we can control, that makes a way forward.
Yes, exactly right. Yeah.
I'm wondering, in terms of your types of services and treatment options that you offer, How long is the process? Can it be done in intense short periods? What is it
Yeah.
that you offer and could be
Yeah.
available if any of our listeners are thinking, yes, this could actually be helpful for them?
Yeah, that's another lovely question. So I work in a couple of different ways. I work at Cabrini in Elstonwick in Melbourne at the Women's Mental Health Unit there. So I can admit clients there, and it's usually a very short stay. So it's about a 10-day stay, 10 to 12 days. And during that time, we'll have time to work on probably 5 different targets, intensive treatment. So over quite a short period of time, we get done the work of maybe 2 months of regular sort of weekly therapy. So that's a nice option for people who want to kind of be very focused and work very hard in a short period of time. And in a similar vein, I do what's called an EMDR intensive. And this is a kind of a new way of working. So instead of, meeting weekly or fortnightly for sort of months at a time, we meet once and take the history and do some planning. And then the next time we meet for 4 hours, usually on a Saturday morning, and then we'll approach usually 3, sometimes 4, and work on those and resolve those. So, and then we'll meet again, say 6 weeks later for a review and a top up sometimes. So that's also really popular for people who are time poor, who can't, or who are doing shift work or something like that, and find it really hard to kind of slot those weekly appointments into their schedule. So
Yeah.
all they have to do is find time on one Saturday morning, and we do a power of work in that morning, and we can approach some really big traumas in that time.
Some of the listeners might not be in Victoria, Australia, and I know through COVID we developed a lot of telemedicine conferences and things. Is this
Yeah,
something also that you would offer, like an
yeah,
online experience
yeah.
where people can engage your services in that way?
I do. So I have a 6-week course. So that's an opportunity. So that is a weekly model, but it's group EMDR, which is a little bit different,
Mm,
and it's online. So it is available to people who, say, live in the country
yeah,
or have
fantastic.
mobility issues and can't leave the house or need to kind of, be with.
Yeah,
So that's a 2-hour block of EMDR therapy once a week for 6 weeks.
amazing.
And that goes alongside some sort of pre-prepared psycho-ed videos that I've got about trauma and about EMDR, about how to manage triggers and all of that sort of thing, that are sort of sent out weekly. So, so that's another way of working with me. So group EMDR is a little bit different to one-on-one EMDR. So this is sort of the most important thing. There's no sharing of the trauma in the group.
Okay, I wondered, and I'm sure
Yeah,
listeners would be wondering how that works when a lot of
yes,
trauma is very personal, and
very personal.
we've kept
Mm,
it close for a long time, and to
mm,
share that
mm,
with others
mm.
is to share it
Yeah,
with
so
ourselves is hard enough,
yes,
but to share it with
exactly.
others is hard. So there's no sharing in
So
this.
there's no
Okay.
sharing. I meet each person individually, and we
Hmm.
make a plan, and we decide on which memories to work on each week. And they get a workbook, and they can write all that in the workbook. And then online, they can use the butterfly tapping. So that's instead of the eye movements,
Yeah.
they can use the butterfly tapping, or they can do eye movements by following their fingers, like tapping on the table in front of them and following their fingers from side to side. So that gives them the eye movement, and they do their planning in their workbook with me and write down the trauma that they're going to work on. And then when we start, we say hello to each other, but we don't talk about their own particular traumas. They might ask me some questions about the process, or what do I do if this happens, and I can give them some pointers and answer questions about the process, but we don't share our trauma. So, and then when we do the processing, the actual EMDR processing, I have an assistant who works with me, and if somebody gets upset or is confused about something and wants to ask a question,
Right.
my assistant can take them into a Zoom room and give them a little
Yeah.
bit of one-on-one attention,
Yeah.
and then bring them back to the group and continue on with the processing.
Oh, that's really interesting to see how it
Yeah.
actually work out.
Group EMDR is just as effective as one-on-one therapy with EMDR if it's set up properly. And it's cheaper, it's more accessible in that you don't have to drive to see me, you don't have to navigate leaving the house, and for some people distance is a real issue. So it makes it more accessible too. So it's an exciting development.
I think that's amazing. A really great opportunity that is available to people who might otherwise, not have 10 days to go in and be an inpatient. Or, I mean, often people carry around trauma their whole life.
They do.
I'm wondering if people are listening thinking, well, heck, 2 hours every week for 6 weeks, that's a big commitment. But they might be living with, or they have lived with this trauma for decades. So
That's
I'm
right.
thinking, compared to maybe traditional types of counselling that might take several years, actually 6 weeks could give them a very good kickstart.
Absolutely.
In making progress with moving through that.
Yeah, I mean, it can be life-changing. I personally have experienced EMDR, and for me, it has been life-changing.
Wow.
And I see that in my clients, every week, that they come in and they say, look, my partner has said to me that I'm easier to talk to now, that I'm less reactive, that I don't get so grumpy with the kids.
Life-changing, not only for the person, but for everybody.
Yes,
Everybody.
exactly.
Yeah,
because if you're not carrying the anxiety of your trauma and the worries and the self-concept about yourself that the trauma kind of, instilled in you, then you're a much happier, calmer, more able to concentrate. There's so many benefits, and it really is. It really is quite transformative. I'm a bit addicted to EMDR, to actually, to giving it.
It sounds very hopeful.
It's fabulous, yeah. Yeah. And there's a lot of evidence, like there's decades of evidence to show that it works. So, I'm aware that I can come across as a bit of a zealot sometimes because, I promote it everywhere I go. But, there's lots of scientific evidence to show that it does work and that it's very effective.
Fantastic.
Yeah.
I'm wondering about the effects of trauma on sleep in particular. How does it affect people's sleep? And have you seen people achieve better sleep, I guess, after this
absolutely.
process?
Yeah. So, what example? So I have to be a bit careful about giving you examples, but it's certainly not uncommon for me to take history at the beginning and to find that people are really having quite severe difficulty with sleep. They don't want to go to bed because they don't want to dream. They don't want to have the nightmares about being chased, or the nightmares about being assaulted, or, the nightmares about, whatever their nightmares are about. So they're afraid of going to sleep because they know that they're going to wake up in terror. And as we process the events that cause the terror, the nightmares disappear. And then as a result of that, people stop being afraid to go to sleep. And, I've seen that many times. It's really fabulous. Sort of, we come back and we check in on things, and I say, how are you sleeping? And they go, well, actually, I got 8 hours last night, and it's just amazing.
It changes everything, doesn't it? Sleep. If you haven't got it,
Yeah, and the hypervigilance around the trauma, and
Mm,
I don't want to go drive. I don't want to drive today because I'm feeling a bit upset, and I know that I'll just expect a truck to come around every corner. That sort of hypervigilance.
mm,
People with PTSD, or who are carrying a lot of trauma, even if they don't have a formal diagnosis of PTSD, people who live in that sort of really elevated, anxious state all day, it only takes a little bit to sort of push them into panic. So
yeah,
if we can bring down that hypervigilance, even just 10%, it really makes a big difference. And and that applies to going to sleep as well. So if you go to bed and you're thinking about, worrying about things and imagining what tomorrow's going to bring, and worrying about, did I do okay today at work, and all of that sort of thing. If we can alleviate some of those memories that cause those thoughts about yourself and the worries about tomorrow, then we can bring down that hypervigilance. It becomes much easier.
that's terrific. Can you
Yeah.
describe the role of hypnosis in addressing trauma and also food addiction and eating disorders, and how it
Yeah.
complements the EMDR therapy?
I trained in hypnosis, it must be maybe about 15 years ago or longer. I went through a phase where I used it a lot. I was working much more in the eating disorders arena. Well, I was working in the bariatric arena, so I was seeing people who were really wanting to lose weight and finding that there were barriers to losing weight, and people would come to me and they would say to me, I'm addicted to chocolate. I just can't leave it alone. I just have to have it. I can't drive past a service station without buying it. So I went and learned hypnosis in order to help people with that, and used it for a couple of years with really mixed success, Ros. And I think that this
Yeah.
probably relates to my level of ability as well. So I don't use hypnosis really much anymore. It's not my preferred method. Like EMDR is my great passion in life. But I do use it a little bit to help people with relaxation and help people sort of ground themselves and get out of that really highly agitated kind of mode. But when I was using it a lot, I was using it for that chocolate addiction, and I found that I could be very successful in helping people stop eating chocolate. They would come back. I actually have a couple of funny stories about that. So one lady came back to me like months later after we'd done the stop eating chocolate hypnosis. And I said, how's the chocolate going? And she says, oh, I hate chocolate. I said, oh, that's good. That's good. I'm glad you're not eating chocolate anymore. And she says, no, I've never eaten chocolate. I hate it.
Incredible.
And she said, I actually went to my hairdresser the other day and she brought me a cappuccino. And I said, oh, I can't drink that. It's got chocolate on top.
Wow,
So,
very powerful result.
so a very powerful result. So that was terrific. But what we found, and that stuck for her,
Yeah.
stuck. She no longer wanted chocolate, didn't feel attracted to it, had forgotten that she'd ever liked
Gosh.
it.
Yeah, incredible.
But what we found was that she started overeating some other sweet things. So
Right.
So we'd addressed the chocolate part of the addiction, but we hadn't addressed the addiction part of the addiction. And at that stage, I realized that I needed to learn more about addiction, and that led me to the trauma work,
I
because
see.
addiction is just a symptom of trauma. You don't get addiction by itself without having some very powerful reasons that people get addicted to anything. And that can be gambling, shopping, alcohol, smoking, chocolate, different behaviours. So behind every addiction is a trauma. And if you haven't found the trauma, then it's just well hidden. Yeah, so people, and I'm speaking very broadly here, but people generally develop addictive behaviours because there's stuff that is just too painful to allow it to be at the surface. So,
We're
yeah.
also working with people with addictions that may have not even acknowledged the trauma
Yeah.
yet.
It often doesn't take very much digging to
Yeah,
find the trauma.
I see.
So yeah, yeah.
Mm.
And
Oh,
yeah,
that's
it's often just that little bit below the surface. And
mm.
yeah, so um
We're very clever
yeah,
at masking things,
we are.
aren't we? And sort of
We are.
trying to maintain a status quo and just carry on. And our body just has ways of coping, and some of those
Yeah,
ways, unfortunately, are so dysfunctional and so harmful.
that's exactly right.
Yeah.
Because addiction, it's not just the behavior of the stuff that you take or what you're addicted to, but it's everything that sort of rolls on from that, and
Yeah. Oh
can be
boy.
very destructive.
Well, I sure am glad that there's health professionals like yourself that are specialising in this space, because
Thanks,
there's a lot
Rox.
of
That's
pain
lovely.
that people are suffering on their own,
Yeah,
and there are people who can help them.
yeah,
Just in
yeah.
terms of that, when I think of, health professionals and the variety that there is, how do you collaborate with other healthcare professionals,
Mm.
maybe such as nutritionists? I'm not sure. Maybe there's a role for diet and exercise in all of this. I don't know.
There
But
absolutely
right.
is, yeah. So finding a nutritionist who has a bit of an understanding about eating behaviours as well as the content of what you eat is really important if you're struggling with eating behaviours, because it's not just about the knowledge, it's about the need. I work at Cabrini. We have a fantastic exercise physiologist who sees all of our clients, and she works out a program for them. And she is very, very trauma informed and very much aware of the effect of trauma on people's um, approach to their body and comfort with their body and ability to be in their body. So she's an incredible asset that we have at Cabrini. And I haven't found anyone else just quite like her in the community, but I do know in South Melbourne there's a trauma-informed, I think it's trauma-informed kickboxing. I'll have to find the name of that group, but yeah, so they're very much about helping women to feel more powerful. Of course, it's not only women who feel powerless in our society, but that's kind of her specialty. So, yes, so finding someone trauma informed is sometimes a bit of a tricky ask,
Yeah.
but if you do a trauma informed yoga search on Google, nowadays, you'll probably find someone close to you who does practice trauma informed yoga. A lot about that is permission and kind of giving yourself permission to do what you need to do and take notice of your body in the way that you are able and prepared to.
I actually find that's actually key for a lot of people, giving ourselves permission to take
Mm-hmm.
time out of the busyness of everything that's going on, whether it's raising a young family or working shift work or a full-time job or whatever. I
Yeah.
mean, giving ourselves permission to actually address our own needs is really
You are so
something that
right.
hasn't
Yeah.
come naturally for a lot of us. And it's only
No,
until
no.
we come up against a crisis or a diagnosis or something that
Mm,
stops us in our tracks, a major
mm,
life change
yeah.
that leaves us no choice to deal with
Yes.
ourselves, that we actually
Yes.
take action. But yeah,
Yes. So we don't often realize that we're running on empty until, you know,
right.
until something uncovers that for
Yeah.
us. So filling your cup is so important. Self care is not just a pretty
Mm.
extra.
Oh, yeah.
It's so
Mm.
essential. It really is essential.
Mm.
Yes, and whatever that looks like for you, it can be as simple as a walk with a dog or doing a bit of crochet at night time, or
Mm.
whatever allows you to be a little bit quiet and present with yourself. Really
Mm.
important in today's day and age where we're so busy and so
Yeah.
overstretched and so overstimulated
Yes.
as well. You know, we hop on Instagram and we think we're relaxing by doing the scrolling, but it's actually just more and more, you know, stimulation for our brain.
Yes.
We really need, and I'm guilty of
Oh,
that
we
as
all
well.
are.
You know, when I walk the dog, I listen to a podcast,
Yeah.
which I've actually just decided recently to stop
Mm.
doing. So I've decided now that my walking the dog time is going to
Mm.
be about mindfulness and me and the dog and the neighbourhood, you know.
Yes.
So
Really
yes,
life
it's so
changing
easy to
actually
get
when
caught
you
up.
do make those decisions. And I think there's a
Yeah.
time for both. There's a time to use that net time either when we're driving, or sometimes for people it is when they're doing their walk, but sometimes it's like turn it all off. Oh my
Yeah.
gosh. Listen to the birds and see the sky and the clouds and feel the sand beneath your feet or the grass, and it's like being
Yes,
present
so
is
true.
yeah, there's
So
certainly a
true.
time for that too.
Yeah.
Carolyn, what's the best way for listeners to get in touch with you? Yeah.
Probably through either through my website, which is EMDR Doctor. So if they go to my website, there's a contact page, and I think there's a phone number on there.
Okay,
So,
fantastic.
or through my Instagram channel, which is at EMDR Doctor. And my Facebook page is, I forget to post on there, but it is there, EMDR Doctor.
Okay, EMDR Doctor. Well, thank you so much for your
Very
time,
kind.
Carolyn. It's been such an insightful discussion, and I really thank you for your time.
Oh, it's just a delight to talk to you, Ros. It's lovely to hear that people are interested and passionate about wellness and that mind-body connection and how we can help ourselves. It's terrific. You know, the more people talk about it, the better we all are off.
I think that's so true. We hear other people's stories and we learn from them, and we learn about new practitioners that we have no idea about beforehand, and we're all learning together. I think that's the joy of it, and just helping each other move forward in better health. So thank you so much again.
That's so lovely. Thank you. It's been a pleasure.